Hi, my name is Taylor Giordano, and I'm talking about resilience within sexual assault. Sexual assault is more common than many think. CDC statistics show that 1 in 3 women experience sexual assault throughout their lifetime. Sexual assault is any type of sexual activity that's not consented by both people. Women are more likely to experience sexual assault, and sexual assault began getting research attention in the 70s as society as a whole was going through a feminist awakening. And it was kind of developed at the same time as PTSD, other known as combat trauma at that time. Here's my table of contents. I'm going to be starting with the negative impacts, intro to EMDR, connections to stimulus, my research question, my first claim, my second claim, my resolution, and my limitations and rebuttal. First, negative impacts. Sexual assault is associated with a lot of psychological traumas and harms. Victims of sexual assault are at high risk of developing a wide array of psychological problems, including substance abuse, depression, anxiety, suicidal ideation, etc. The most prominent one, Milo Covers, a researcher scientist at Wilhelmina Children's Hospital, Netherlands, says that 94% of victims experience PTSD symptoms in the immediate aftermath. Now, intro to EMDR, a type of therapy. EMDR works through competition where the brain stores information on sight and sound and where it processes working memory. Theoretically, recalling a memory at the same time your eyes are moving back and forth forces your brain to split its resources. You can't dedicate all your focus to what you're hearing and what you're seeing at the same time. This causes the victim to, this split focus can make any disturbing images the victim recalls less vivid, and they may feel comfortably distanced from them. In this way, the victim may feel the emotional impact of the memories less. This is the connections to the stimulus. I used in their own words, having resilience, not giving up, Marcus Aurelius, importance of unity and self-improvement, and the dark side, where too much is resilience equals harm. This is how they connect to my research question. First, no matter what one does, adversity cannot be avoided and needs to be addressed in order to improve. Second, communities posing as a support system help people overcome their hardships. And 3, acting strong and trying to avoid a problem such situation can only harm oneself more. This brings us to the question, to what extent does EMDR therapy help build resilience to mental trauma in women who have been sexually assaulted? First, we're going to talk about the effectiveness. EMDR is very effective in removing the pain of all old memories. It's effective in helping clients judge themselves more fairly, not having to talk in depth about the trauma in order to heal, and desensitizing a person to the thing that triggered their anxiety. I concluded all of these points from William Zangwill, Jonathan Hutchins, California Behavioral Health Center, and Hope Gillett. Jonathan Hutchins, a mental health researcher, stated, "This therapy is recognized as an effective treatment by a number of national and international organizations, including the World Health Organization and the American Psychiatric Association," which further proves the effectiveness of this therapy. Second, the efficiency. EMDR is very efficient due to it only requiring a short amount of sessions. Some patients showed complete relief of the trauma. The California Behavioral Center stated the National Institutes of Health reported that of 10 studies done on EMDR therapy, 7 found it to be more effective and quicker than trauma-focused cognitive behavioral therapy. My proposed resolution is that EMDR is overall extremely effective for helping build resilience within a woman who has been sexually assaulted. My limitation is that sexual assault survivors may not be able to tolerate EMDR therapy due to the vulnerability and stress of it. However, Susanna Kaufman, a therapist in Santa Rosa, California, states that survivors have already overcome so much, it can only help them alleviate that pain. Some regular therapy may be worse and have even more negative impacts on the people. With EMDR therapy, in conclusion, EMDR therapy is one of the most effective and efficient types and is beneficial for helping build resilience in women that have been sexually assaulted and assisting them into healing. Sexual assault disproportionately affects so many women in our world and can have many harmful consequences. PTSD is a common effect of this and needs to be treated by therapy. That is when EMDR therapy comes in place. Thank you. And it is overall very effective. Let's talk about why it is better than other types of therapies. EMDR,
Okay, let's talk about your research. Okay.
sorry.
It's fine. It's fine. Taylor, how did your research question evolve as you moved through the process?
At first, I started with a solution-based question, and I was researching what type of therapeutic intervention would be best for helping women overcome this and for gaining resilience. But as I went through it, I discovered that it doesn't fully connect back to some of the evidence that I was using, and it wasn't making a full circle.
Mm-hmm.
So I decided to change it to what extent question, so people would be able to better understand how it actually helps women that are going through sexual assault and how it can help them heal.
Okay. And what are the implications of your findings to your community?
The implications of my findings to my community can help. This is my works cited. The implications can help. The implications of my solution can help the community by my solution can help the community by giving insight on women that may be going through sexual assault and help them know what they can do to heal from this and get help.
Thank you.
Right.